A fungus is a member of a plant kingdom, fungi, that includes yeast and molds. Fungi are found everywhere in the environment and thrive in dark, moist places. Most of the time, these microorganisms exist in harmony with humans. However, they can become pathogens and cause infection. A fungal infection is called a mycosis or a mycotic infection. Fungi can be ingested or inhaled, and they easily grow on skin and nails. Some fungal infections, such as athlete's foot, are localized, kept to a specific area, whereas others, such as an invasive candidiasis caused by a Candida yeast, can become systemic and spread throughout the patient's whole body. When fungi come into contact with a person who has reduced immunity, they take advantage of the weakened immune system and cause infection. For this reason, they are called opportunistic infections. Patients at increased risk for developing a fungal infection include patients with diabetes, pregnant women, and women taking birth control drugs. Patients taking corticosteroids, persons who are taking antibiotics, and particularly women, and newborns. Transplant patients who are taking immunosuppressive drugs, cancer patients on chemotherapy, and patients with AIDS are at risk for developing severe systemic fungal infections. Fungi are more complex organisms than bacteria and more closely resemble human cells. They require drugs that act in a different way than antibacterials. In addition, because antifungal drugs often target the same structures that human cells have, they usually have more side effects and reactions when taken systemically. Antifungal. Their action is that they prevent the production of lipid-like substance that form the fungal cell membrane. The examples are fluconazole, known as diflucan, ketoconazole, known as Nixerol, and miconazole. Antifungal drugs are used orally, intravenously, topically, and vaginally to treat a variety of fungal or mycotic infections. Antifungal drugs have 6 classifications: the azoles, the polyenes, the allylamines, antifungal antibiotics, antimetabolites, and echinocanids. Azoles and polyenes and allylamines all prevent the production of lipid-like substances that forms the fungal cell membrane. Without the cell membrane, the fungus becomes damaged and cannot produce fungostatic effect, or dies, fungocidal effect. The antifungal drug grisofulvin stops the fungus from reproducing. Antimetabolites, flucosotine, disrupts the metabolic pathway of the fungal cell and interfere with reproduction and growth of the fungus. Echinocanids damage the cell wall of the fungus, killing it. They are the newest class of antifungals and are given only by the IV route for the treatment of invasive candidiasis, especially in critically ill patients. The action and specific uses of common systemic antifungal drugs. Instructions for patients using topical antifungal agents for superficial fungal infections are presented in a box 6.1. Teaching points for patients using topical antifungal drugs. There are some general principles. Report any indication of an allergic reaction, new redness, swelling, blisters, skin, peeling, or drainage, to the healthcare provider. Wash your hands to remove all traces of the drug immediately after applying it. Avoid getting any antifungal drug in your eye. If the drug gets into your eye, wash it with large amounts of warm, running tap water and notify the healthcare provider. Use the drug exactly as it's prescribed and for as long as prescribed to ensure that the infection is cured. The teaching point to patients in regards to applying powder to ensure that the skin area is clean and completely dry before applying the powder to prevent it from caking, to hold your breath while applying to avoid inhaling the drug. For the foot area, be sure to get the powder between and under your toes. Wear clean cotton socks night and day. Change the socks at least twice daily. For the groin area, wear clean, close-fitting but not tight cotton underwear, briefs for panties, to keep the drug intact with the areas that are infected. The teaching points in regards to dermal lotions, creams, and ointments: ensure that the skin is clean and dry before applying the drug to ensure best contact with the affected area. Be careful to apply the drug only to the skin that has the infection. Keep it off the surrounding skin to prevent healthy skin from reacting to the drug. Apply a thin coating as often as prescribed. Wash the drug area and dry it immediately before applying the next dose to ensure that the fresh drug is able to come in contact with the affected area. Loosely cover the area to prevent spreading the drug to the other body parts, clothing, or furniture. The teaching points in administering an oral lozenge is to brush the teeth and the tongue before using the tablet or crochet to remove as much of the organism as possible so that the drug can come into contact with the affected area. Let the tablet or the crochet completely dissolve in your mouth for maximum release of the drug. Clean the toothbrush daily by running it through the dishwasher or soaking it in a solution of 1 part household bleach with 9 parts of water. After using bleach, rinse the toothbrush thoroughly. Cleaning keeps the infection from reoccurring. The teaching points in regards to vaginal creams and suppositories. The vaginal creams and suppositories should be placed just before going to bed to help keep them within the vaginal cavity longer. Wash your hands before inserting the drug to avoid getting other organisms into the vagina. Insert a suppository, rounded end first, into the vagina as far as you can reach with your fingers so that the drug reaches all affected areas. Insert an applicator full of the cream as far into the vagina as is comfortable so that the drug reaches all affected areas. Wash the applicator and your hands with warm, soapy water. Rinse well and dry to prevent reinfecting yourself with organisms left on the applicator. A sanitary napkin can be worn to protect your clothing and the bed from drug leakage. Avoid sexual intercourse during the treatment period. If you do have intercourse, the drug can make holes in a condom or damage the diaphragm and increase your risk for unplanned pregnancy. You could also spread the infection or get reinfected with the yeast. Miaconazole should not be used intravaginally for longer than 7 days. The healthcare provider should be contacted if there is no improvement in symptoms after 3 days. Topical application for athlete's foot, tinea pedis, or ringworm, dermatomycosis, should not exceed 4 weeks. An application for jock itch, tinea crucis, should not exceed 2 weeks. The nursing implications in patient teaching. Ask about an allergy, bone marrow depression, use of alcohol or other drugs that may produce drug interactions, particularly corticosteroids, and the possibility of pregnancy. Some antifungal drugs can be teratogenic, cause birth defects. The patient may have a history of fever and chills at the onset of infection. Many patients report itching if they have a fungal infection. A history of recent antibiotic therapy is common. Inspect the mouth for the classic signs of thick white, non-movable plaques that coat the tongue and the erythema, redness, or irritation associated with thrush. Candida infection. The patient may also have a history of multiple scaly or blistered red patches on the skin, itchy and soreness of infected areas, or brittle nails with yellow discoloration and separation from the nail bed. Check current laboratory work for CBC, platelet count, BUN, creatinine, and liver enzyme values to establish a baseline and to prevent kidney, liver, or hematological damage. Check and document vital signs, accurate height and weight measurements, and culture and sensitivity reports. The patient teaching. Teach the patient not to take any over-the-counter drugs and let the healthcare provider know of all drugs that the patient is currently taking, or if any other healthcare practitioner may prescribe during the treatment, because antifungals have many possible drug-to-drug interactions. Take grisofulvin with high-fat foods or meals like cheeseburgers, whole milk, or ice cream. This causes more of the drug to be absorbed and reduces possible stomach upset. Avoid direct sunlight and wear sunscreen and protective clothing while outside to prevent severe sunburn while taking ketoconazole, voriconazole, or grisofulvin. Notify the healthcare provider if you have a dark urine, light-colored stool, or yellowing of the white of the eyes, or the signs of liver problems. Notify the healthcare provider if you have an increased fatigue or shortness of breath, which may indicate anemia. Be alert to flu symptoms, rash, or blister, and notify the healthcare provider immediately because these symptoms can indicate a severe adverse reaction to the drug and require hospitalization. Notify the healthcare provider about any skin rash or worsening nausea, vomiting, or diarrhea. When taking more than one capsule per day, spacing them at least 15 minutes apart can reduce the likelihood of GI upset. If symptoms do not resolve within 2 to 3 days, notify the healthcare provider. Finish all of the drugs you were given, even if your symptoms improve, so that the infection does not return and resistance to the antifungal does not develop. If you take an azole, do not take the drug with grapefruit juice and limit the amount of grapefruit juice you drink daily because it increases the potency of the drug, increasing the risk for adverse effects. Observe the patient for any signs of allergic reactions such as high swelling of the lips and face, rapid pulse, or low blood pressure. Alert the rapid response team immediately if any of these symptoms occur because they indicate an anaphylactic reaction. Check the skin for rash, blisters, or increased itching that may indicate an adverse reaction or worsening of the fungal infection. Assess the site of infection daily for any changes and document your findings. Assess vital signs as ordered daily and alert the healthcare provider to any changes, particularly changes in temperature and pulse rate. Check the patient daily for signs of jaundice that may indicate hepatotoxicity, yellowing of the skin, yellowing of the eye, sclera, dark urine, clay-colored stool, and abdominal pain. Assess for ongoing ordered laboratory work for any abnormalities that could indicate the adverse reaction of worsening of disease and symptoms. Alert the healthcare provider as soon as possible if there are any changes from the baseline levels of lab. The nursing implications for diflucan and Nizoral. The length of treatment depends upon the nature of the infection. Tell the patients to take the drugs as they are prescribed for as long as they are prescribed to ensure the adequate protection against infection or adequate treatment of infection. Instruct patients to monitor for rash, redness, or blistering because this could indicate a serious medical emergency called Stevens-Johnson syndrome. If these symptoms occur, they must notify the healthcare provider immediately. Instruct patients taking oral anti-diabetic drugs to monitor glucose levels closely. These drugs can cause fluctuations in glucose control. Monitor blood urea, nitrogen, BUN, creatinine, and liver function studies because these drugs can cause kidney and liver damage. Tell patients to report yellow skin, light-colored stools, dark urine, or yellowing of the eye sclera to the healthcare provider because these are indications of adverse liver reactions. Mix IV doses of fluconazole according to the manufacturer's direction and give no faster than 200 milligrams per hour to reduce the risk of cardiac dysrhythmias. Teach patients how to take their pulse daily and report the pulse greater than 100 beats per minute, lower than 60 beats per minute, or a newly irregular heart rate to the healthcare provider because these drugs can cause cardiac rhythm problems. Instruct the patients to take ketoconazole with an acid beverage such as cola to increase its absorption. Teach sexually active women to use effective birth control while taking azoles because these drugs may cause birth defects. Expected side effects and adverse reactions. Nausea, vomiting, and diarrhea are the common expected side effects of antifungal drugs. Adverse reactions are associated with more severe problems such as neurological, cardiac, hematological, liver, and renal toxicity. Skin reactions, rashes, and a rare serious rash such as Stevens-Johnson syndrome can occur. Stevens-Johnson syndrome begins with a painful red or purple rash, blisters, and flu symptoms. It is a medical emergency. Amphotericin B in particular, which is given intravenously, is associated with numerous adverse reactions, and patients are pre-medicated with antihistamines, antipyretics, corticosteroids, and opioids to prevent them. Amphotericin B is associated with serious adverse effects, and these patients must be closely monitored. Increased sun sensitivity, also known as photosensitivity, can cause severe sunburn in patients taking ketoconazole, voriconazole, or griselfulvin. Griselfulvin can cause liver toxicity and numbness and tingling of the hands and feet. Paresthesia. Lamisil, also known as terbinafine, and flucistocine, also known as Ancobon, can increase the risk for infection because they can reduce the risk of white blood cell count. Terbinafine is also associated with hair loss in some individuals. Azoles at high doses given intravenously can cause life-threatening cardiac dysrhythmias. The drug-to-drug interactions. Superinfections can result when antifungals are given together with corticosteroid therapy because corticosteroids reduce the immunity response, making the person more vulnerable to fungal infections. The activity of oral anticoagulants is decreased when used at the same time as griselfulvin. Fluconazole and itraconazole increase the effects of anticoagulants, causing patients to bleed, and can cause hypoglycemia. When used with an oral hypoglycemic. Voriconazole interferes with many antidysrhythmic drugs and can cause life-threatening dysrhythmias. Antacids, anticholinergics, and H2 blockers, famotidine, Pepcid, and nizatidine, Axid, change gastrointestinal pH and interfere with drug absorption. Toxicity can result with flucistocine is used together with other drugs that depress bone marrow and during radiation therapy. Use of flucistocine with hepatotoxic or nephrotoxic drugs should be avoided. The use of flucistocine also decreases leukocyte and platelet counts and hemoglobin levels. Consult drug reference or a pharmacist for information when other drugs are prescribed during antifungal therapy. The tip or top tip for safety: adverse reactions to systemic antifungals such as peeling, blistering, itching, burning, and redness of the skin are similar to the symptoms of the diseases they are intended to cure. It is therefore sometimes difficult to determine whether the patient needs more or less of the drug. The evaluation or expected outcomes: observe the patient for therapeutic effects. Chills or fever associated with some infection should disappear and signs and symptoms should improve. Also watch for development of adverse effects and signs of GI distress. Remind the patient to continue taking the drug for the prescribed length of time and/or until the laboratory tests show that normal function has returned. There should be decrease in skin irritation, and a therapeutic response is usually seen after 1 week. There should also be a decrease in signs and symptoms of infection noted to the affected area.